Hello, my name is Kennedy Thompson, and this is my podcast for Nursing 5018 Healthcare Policy and Advocacy. So, for this podcast, I had to answer 3 questions that involve nursing educators and policy. So, the first question is discuss the difference between internal and external factors that influence policy and describe examples of both. So, internal includes factors that originate in an organization or institution and affects how policies are developed and implemented. So, for example, faculty shortages, if there are not enough educators to educate these students, and faculty development when they are lacking like funding for training and they cannot meet modern teaching standards. This just lacks in the policies because students are unable to learn due to internal factors that develop. External includes factors that come from outside organizations and often drive policy changes through regulatory, economic, political, or societal pressures. So examples of these may include State Board of Nursing regulations, mandating inclusion of population and health content, or rapid changes in healthcare technology. And for example, that includes like AI in nursing education. So this is just something that nurse educators have to learn to teach the students. Telehealth, this is something that we have to learn as a unit because they're starting to use telehealth in the hospitals as well. So just teaching these students how to use telehealth in and outside of the hospital. And then electronic health records. And just these updates that we have to learn ourselves to teach these nursing students. And if we don't, it can create outdated and delayed nursing strategies and standards, and we don't want that. The second question is, why is it important for nurse educators to be aware of and understand the implications of policies that may affect nursing education? So why is it important? I feel like it's very important for us to understand because it directly affects curriculum design. So when we know about these things, we can just use these in our curriculum to teach the nursing students. Accreditation standards, funding for programs, and then just student outcome in general. We want the students to have the best outcome that they can possibly have. So just being aware and understanding those policies, we have to understand so that we can correctly implement them into the nursing educating standards. This ensures that educational practices align with national nursing competencies. We want the nursing students to be very competent in their care, know exactly what they are doing, and know exactly what the national programs want them to know. Licensure requirements, and then ethical standards as well. And for example, policies related to clinical placement hours or telehealth training can shape how to prepare the future nurses to meet healthcare system demands. So just knowing these things is important. And number 3, how can nurse educators influence health policy? They can advocate, especially for funding for different educational purposes, leadership, research, collaboration. They can engage in professional organizations like the American Association for Nursing, American Nurses Association, National League of Nursing, National Black Nurses Association, and this is something that I might be interested in as well. They can be student mentors, and with this, they can make the students aware and build a policy-aware nursing workforce, which is very important. Also conducting research so that they can define links between education and quality and patient outcomes. So all of this is important. This is my podcast for my 3 questions, and I hope you guys enjoyed it. Thank you.